Dear colleagues, today we will show you mock-up procedure on the live patient. So you will see exactly what our participants during veneer course are able to see with all these explanations and tips and tricks related to the SMILE test drive. Before I start, I would like to kindly ask you again not to forget to put likes. It's so easy, but the algorithms of YouTube will share this video with our colleagues, and everybody will benefit from the information that we are kindly sharing with you from the bottom of our heart. Let's go. So first, I check my silicon index to be sure it goes very passive, no interference. So very easy going. Can you close your mouth, please, to bite a bit? Sometimes I also ask my patient to close and to see if both sides are touching silicon index. In this case, we can actually use our patient's mandible to hold it. So I'll have two hands to remove some excess. But in his case, only canine and premolar is acting. So I will hold everything myself. The thing that I didn't mention to you, when you will fill your bisacral material inside the silicon index, and when you go into the patient's mouth, you have to press, but not from the buccal side, because if you will press from the buccal side, in case if you have additive wax up, right, which means there is a space between tooth and the silicon, you press on the vestibular side, you get thin mock-up. Yeah. But the very important thing is to have optimal thickness of the silicon also. It has to be, that's actually 1 centimeter or 10 millimeters, it's fine. If it is thinner, you may get some kind of distortion. Even if you use hard silicon. It's hard, it's not distorted that much, but it's still, there is a risk if you press from the buccal side, it may get distortion. So where you have to press, you fill your bisacral there, you go. You can press from the palatal side here, and you can stabilize with your thumbs somewhere in the back area like that. But don't press here. Okay, you can press here, but not here. Okay, then I ask you to close a little bit, close. Then when I will have access, I will move upper lip of my patient the way, so I will give room for assistant to remove the excess of the material, right? Okay, so we're ready for that. So first portion, we bring to the napkin. The first portion of the material, we go to the napkin. We don't do anything with teeth, just dry them. Okay, and then we go from 5 to 5. In our case, we do it from 5 to 5. And we have to do it quickly. Press on here. Close a little bit. So I'm moving the upper lip a bit up with Optrogate, and assistant take the black instrument. With this side, yeah. And you need to check from time to time to check if material start to set or not. It can be a liquid, but in a few seconds it can become hard. So assistant has to control the process. Check again. You see? And we do not use sharp instrument because if it's sharp, assistant can touch the gingiva of the patient. Patient will be not very happy for that. Can you hear? Yeah. Now I hold it with my left hand, so I can clean up this. We can take now the tweezers. Okay, good. I will wait for about a minute. You need to read the instruction in terms to understand the time of. Is everything is good? The light. Yeah. We give to usually we give to patient the dark glasses so they can resist the light from the microscope. Okay, so now how I will remove the silicone index. You remember? No, we are not going down. We lift it up and then we go down. And the next will be what? The magic finger technique. Magic touch. I will do it with a higher magnification, so you will see how it looks like.
Is it magic only with your finger?
Exactly. Yeah, for sure. Only mine. So we have it like this. Take it out. Look, I will go with a higher magnification. Look at the surface. It's a monomer, but when you go with a finger over it, finishing and polishing process. Magic. David Copperfield is suiciding now because this is super magic. But look, the essential incisor, the corner is little bit with void. We can keep it like it is. It's not that big. But if it will be bigger, you can repair it with a flow composite. Okay, let's do it just as a demonstration. Can you take a light cure? Because there are some questions, how can we repair if we have some problems with bubbles or whatever. So that's the way. You can take your probe. Can you give me a probe? Explorer, sorry. Mm-hmm. Okay. It's not necessary to do now because that's not big problem here, but it's just to show you how we can handle some of the bubbles or whatever.
Can you light cure it or just need to wait?
Cure. No, this is flow composite. You have to light cure it.
This is it. Composite.
At the end of the day, we use your favorite composite, you see? Bisacryl together with composite. That's to make happy everybody.
Yeah.
Okay, good. Now, we have access from, by the way, there is not many access in our vestibular side. There is a little, which I can really keep there. I mean, this one and this one, because it will be not visible on the video. Okay, this is not visible on the video. Can you take a suction without the coping, and you can remove these small things from here. No, small one. This one, without the cover.
Oh, without this.
Mm-hmm. Mm-hmm. Okay, let me check. Go to the left. Yeah, it's good. But on the palatal side, open. And the palatal side, we have pretty much, you see. So I will take it out, take this thing, and help me. I will lift up this thing. Mm-hmm. And you remember, if I will continue lifting this up, I can break the mock-up from the incisal edge. So what I will do, this is sharp curette. I will just cut it from here. Put suction there, because I'm working with some small particles. I don't want them to go to his throat or stomach or whatever. So assistant actually protects everything with a high volume suction or with any suction. Okay, remove it. Perfect. Let's take this out also. Can you see what I'm doing or not? You can see it on the screen, by the way. Okay. Let's take this out also. I'm not going to remove the whole axis because there is still risk that I can break something. Okay, I will remove everything after we will do video. But if we speak about mock-up that I'm using for myself to see if it works, if it's nice, if it's fitted, and I'm going to prep straight after. Look at these beautiful teeth, my God, I'm very jealous now. The best smile. I can actually let my patient go with the Optragate.
So high, I'm hypnotized. What's up is down, what's left is right. Chasing stars and holding you. I can't see the...
Hope it was useful. And my friends, if you want to see something else, don't be shy. Write in comments what kind of topic you would like us to share, to explain, to show, and we will definitely take this into account. And next time we will film and prepare some specific issues of BG dental tips. Stay strong.
Dangerous times.